Bo Jackson, the superhero who fell. Bo Jackson wasn't just a football player. He was a two-sport professional athlete competing at the highest level in both the NFL and Major League Baseball simultaneously. In football, he played running back for the Los Angeles Raiders, where his combination of size, speed, and power made him nearly impossible to tackle. His athletic ability seemed superhuman, earning him Pro Bowl honors and a reputation as one of the most physically gifted athletes ever to play the game. Then came January 13th, 1991. During an AFC divisional playoff game against the Cincinnati Bengals, Jackson took a handoff and was tackled near the sideline. The hit appeared routine at first, nothing that would stand out in a typical NFL game, but something catastrophic occurred inside his hip joint during that tackle. The impact forced the ball of his femur out of the hip socket. When it popped back into place, the movement damaged the blood vessels supplying the bone. Without adequate blood flow, the bone tissue began to die, a condition called avascular necrosis. Essentially, the bone was starving to death from the inside, unable to receive the oxygen and nutrients it needed to survive. Jackson didn't realize the severity immediately and even tried to walk off the field, but the damage was irreversible. By cutting off blood to the hip, the injury had essentially killed the bone from the inside. Jackson underwent hip replacement surgery and attempted a comeback in baseball, even managing to play for the Chicago White Sox with an artificial hip. However, his football career ended that day in 1991. He was only 28 years old in what should have been his athletic prime, but his body had betrayed him in a way that no amount of rehabilitation could fix. Marcus Lattimore, the knee that bent backwards. Marcus Lattimore entered the University of South Carolina as one of the most highly recruited running backs in the country. By his sophomore year in 2011, he had already rushed for over 1,000 yards and established himself as a future NFL star. Scouts projected him as a potential top 10 draft pick, comparing his vision and power to elite professional running backs. Then came November 3rd, 2012. During a game against Tennessee, Lattimore took a handoff up the middle when he was hit low by a defender. As he was going down, another defender collided with his planted leg. The impact bent his right knee in a direction knees are not designed to bend. His leg folded backward, hyperextending violently. The injury was immediately recognizable as catastrophic. Lattimore suffered tears to his anterior cruciate ligament, posterior cruciate ligament, lateral collateral ligament, and medial collateral ligament. Essentially, all four major stabilizing structures in his knee were destroyed in a single moment. This type of injury is classified as a knee dislocation, and it's considered a limb-threatening emergency because the popliteal artery, a major blood vessel that runs behind the knee, can be damaged. If that artery is torn, the leg can lose blood supply entirely. Additionally, his kneecap dislocated and the cartilage that cushions the joint was severely damaged. Medical personnel stabilized his leg on the field before he was taken to the hospital for emergency evaluation. The damage was so extensive that even with multiple surgeries, the knee's structural integrity could never be fully restored. The San Francisco 49ers still selected Lattimore in the 4th round of the 2013 NFL Draft, hoping his talent would overcome the injury. He spent 2 years attempting to rehabilitate, but the knee never regained the stability or strength required for professional football. In 2014, the 49ers placed him on the reserve retired list. Lattimore never played a single snap in an NFL regular season game, though he did participate in some team practices during his rehabilitation attempts. His career ended at 23 before it truly began. Robert Griffin III, the untouched disaster. Robert Griffin III's 2012 rookie season was one of the most impressive quarterback debuts in NFL history. Playing for the Washington football team, he threw for over 3,000 yards, rushed for over 800 yards, and led his team to the playoffs. His combination of arm strength, speed, and football intelligence made him the NFL Offensive Rookie of the Year and gave Washington hope for a decade of elite quarterback play. During the regular season, Griffin had already suffered a lateral collateral ligament sprain in his right knee. Despite the injury, he continued playing, including in a wildcard playoff game against the Seattle Seahawks on January 6, 2013. In the 4th quarter of that game, Griffin dropped back to pass. As he planted his right leg to throw, the knee suddenly gave out. No defender touched him. His leg simply collapsed beneath him, and he fell to the ground clutching his knee. The ligament damage from earlier in the season, combined with the stress of playing through the injury, had caused complete failure of the joint stability. Medical examination revealed a torn anterior cruciate ligament and additional damage to the lateral collateral ligament. The decision to allow Griffin to play through the initial injury became heavily scrutinized, as continuing to compete on a compromised knee had turned a manageable injury into a career-altering disaster. Griffin underwent reconstructive surgery and missed the entire 2013 preseason. When he returned, he was noticeably different. The explosiveness that defined his rookie year was gone. He couldn't escape pressure with the same speed, and his confidence in the knee never fully returned. Over the following years, he bounced between teams, never recapturing his initial form. The injury transformed him from a franchise cornerstone into a journeyman backup. Ryan Shazier, the scariest tackle. Ryan Shazier was one of the Pittsburgh Steelers' most important defensive players by 2017. Selected in the first round of the 2014 NFL Draft, he had developed into a Pro Bowl linebacker known for his speed and ability to diagnose plays. On December 4, 2017, during a Monday Night Football game against the Cincinnati Bengals, Shazier pursued a ball carrier and lowered his head to make a tackle. This technique, medically referred to as axial loading, occurs when force travels straight down the spine. As he made contact, something went catastrophically wrong with his spine. Shazier immediately collapsed to the ground, unable to get up. He reached for his lower back and tried to move his legs, but they weren't responding. The stadium fell silent as medical personnel rushed onto the field. Teammates and opponents alike stood watching in visible distress, recognizing the severity of what had occurred. Shazier had suffered a spinal contusion, an injury where the spinal cord is compressed or bruised. The impact disrupted the nerve signals between his brain and lower body, causing temporary paralysis. He was immobilized on a backboard and transported to a local hospital, where doctors worked to stabilize his spine and assess the extent of the damage. The injury ended his playing career immediately. Shazier underwent spinal stabilization surgery, specifically targeting vertebrae T10 through T12. To prevent further damage and allow for potential recovery. Over the following months and years, Shazier underwent extensive rehabilitation to regain basic functions. His recovery became a story of determination, as he progressed from being unable to move his legs to eventually walking again. In 2020, the Steelers officially placed him on the reserve retired list. Though Shazier never played another down, his ability to walk again after such a severe spinal injury was considered a medical success. His case also sparked conversations about tackling technique and the long-term risks of leading with the head. Johnny Knox, the bend nobody should make. Johnny Knox played wide receiver for the Chicago Bears, known for his speed and ability to stretch defenses vertically. On December 18, 2011, during a game against the Seattle Seahawks, Knox caught a pass and was running upfield when he was tackled from behind. As he was going to the ground, another defender hit him low. The combination of forces caused Knox's body to fold backward in an unnatural position. His torso bent toward his legs in what's medically termed hyperextension of the spine, compressing his spine in a way the human body is not designed to withstand. The injury was immediately recognized as severe. Knox suffered a fractured vertebra in his thoracic spine, specifically at the T10-T11 level, along with significant soft tissue damage. The fracture and the extreme bending motion put pressure on his spinal cord, creating a risk of permanent neurological damage. He was stabilized on the field and taken to a hospital where doctors determined he would need surgery to repair the damage and prevent further injury to the spinal cord. Knox underwent spinal fusion surgery, a procedure where metal rods and screws are used to stabilize the damaged vertebrae. The surgery was successful in preventing paralysis, and Knox was eventually able to walk and live a normal life. However, the risk of another similar injury was too great to continue playing football. Medical professionals advised him that one more severe impact to his spine could result in paralysis or worse. Knox never returned to the NFL. He was only 25 years old when his career ended. Though he made a full recovery in terms of daily function, the specific demands and risks of professional football were no longer compatible with his spinal health. Steve Young, Death by a Thousand Hits. Steve Young was one of the most accomplished quarterbacks in NFL history, winning 3 Super Bowls with the San Francisco 49ers and earning induction into the Pro Football Hall of Fame. His combination of passing accuracy and mobility made him one of the most dynamic players of the 1990s. However, his career came to an end not from a single catastrophic injury, but from the cumulative effect of repeated head trauma. Throughout his career, Young suffered multiple concussions. Each one occurred when his brain was jolted inside his skull, either from a direct hit to the head or from the sudden deceleration when his head hit the ground. Concussions cause temporary disruption to brain function, and repeated concussions increase the risk of long-term neurological damage. By 1999, Young had already sustained at least 6 diagnosed concussions. On September 27, 1999, during a Monday Night Football game against the Arizona Cardinals, Young dropped back to pass and was hit by Cardinals safety Aeneas Williams while throwing. His head struck the ground and he immediately showed signs of another concussion. This was his 7th documented concussion, though the actual number was likely higher, as many head injuries during that era went unreported or undiagnosed. Medical professionals advised Young that continuing to play posed serious risks. Repeated concussions can lead to chronic traumatic encephalopathy, a degenerative brain disease, as well as increased susceptibility to more severe brain injuries from future impacts. The risk of permanent cognitive impairment or even life-threatening brain injury was too great. Young announced his retirement in June 2000. He was 38 years old and still capable of playing at a high level, but the accumulated damage to his brain made continuing impossible. His case became one of the most prominent examples of how concussions, even when individually managed, can end a career when they accumulate over time. Patrick Ramsey. When infection attacks. Patrick Ramsey was a quarterback who played for several NFL teams during the mid-2000s. In 2007, while playing for the Denver Broncos, he underwent what was supposed to be a routine arthroscopic knee surgery. Arthroscopic procedures are minimally invasive, using small incisions and a camera to repair damage inside the joint. The surgery was expected to require only a few weeks of recovery before Ramsey could return to football activities. However, shortly after the procedure, Ramsey developed an infection in his knee. The infection was caused by methicillin-resistant Staphylococcus aureus, commonly known as MRSA. This is a type of bacteria that is resistant to many standard antibiotics, making it extremely difficult to treat. MRSA infections in surgical sites can spread rapidly, destroying tissue and causing severe complications. The infection in Ramsey's knee caused significant damage to the cartilage and other structures inside the joint. Despite aggressive antibiotic treatment and additional surgeries to clean out the infected tissue, the bacteria continued to cause problems. The infection led to chronic inflammation and pain, and the damage to the knee's internal structures was irreversible. Ramsey attempted to continue his career, but the knee never functioned properly again. The constant pain and instability made it impossible to perform at the level required for professional football. By 2009, he was out of the NFL. What should have been a minor, routine procedure had instead ended his career. Ramsey's case highlighted the often overlooked danger of post-surgical infections in professional sports. While the initial injury or procedure may be manageable, complications from infection can cause damage that is far more severe than the original problem. Terrell Davis, the mysterious breakdown. Terrell Davis was one of the most dominant running backs in NFL history during his brief prime. Playing for the Denver Broncos from 1995 to 2001, he won 2 Super Bowls, earned NFL MVP honors in 1998, and became one of only a handful of running backs to rush for over 2,000 yards in a single season. At his peak, Davis was virtually unstoppable, combining vision, power, and speed in a way that overwhelmed defenses. However, his career was cut short by degenerative knee problems. The injury spiral began in 1999 when Davis tore his ACL and MCL while attempting to make a tackle after an interception. Following surgery and rehabilitation, he experienced ongoing pain and swelling in his knee. Medical examinations revealed that the articular cartilage in his knee, the smooth tissue that covers the ends of bones and allows for frictionless movement, was deteriorating. This condition, known as chondromalacia or cartilage degeneration, was progressively worsening. Cartilage does not have its own blood supply, which means it cannot heal or regenerate effectively once damaged. The exact cause of Davis's cartilage breakdown was never definitively determined. It may have resulted from accumulated wear and tear, genetic predisposition, or some combination of factors. Regardless of the cause, the result was that his knee joint was essentially wearing out. Bone was beginning to rub against bone, causing pain, inflammation, and loss of function. Davis underwent multiple surgeries in an attempt to address the problem. Procedures included cartilage debridement, where damaged tissue is removed, and microfracture surgery, which attempts to stimulate new cartilage growth by creating small fractures in the underlying bone. Despite these interventions, the knee continued to deteriorate. By the 2001 season, Davis was unable to play effectively. He attempted to continue, but the pain and instability were too severe. He retired in 2002 at the age of 29. A player who had been at the peak of his abilities just 3 years earlier was forced to leave the game because his body had broken down in a way that medical science could not repair. Gale Sayers, the slow death. Gale Sayers played running back for the Chicago Bears from 1965 to 1971, and during his peak years, he was considered one of the most elusive and explosive players in NFL history. His ability to change direction and accelerate made him nearly impossible to tackle in open space. However, his career was played during an era when sports medicine and surgical techniques were far less advanced than they are today. In 1968, during his fourth NFL season, Sayers suffered a severe knee injury. He tore ligaments in his right knee, an injury that even today requires extensive surgery and rehabilitation. In the 1960s, the surgical options available were far more limited. Arthroscopic surgery did not exist yet, and reconstructive procedures for ligament tears were in their early stages of development. The repair techniques used were less precise, and the rehabilitation protocols were not as sophisticated as modern methods. Sayers underwent surgery and worked to rehabilitate the knee, eventually returning to play in 1969. He even led the NFL in rushing that season, demonstrating remarkable determination and resilience. However, the knee was never structurally sound again. In 1970, he injured his left knee, suffering similar ligament damage. Now both knees were compromised, and the accumulated damage made it impossible to maintain the explosive movements that had defined his playing style. Sayers attempted to continue playing through 1971, but the speed and cutting ability that made him elite were gone. He retired at the age of 28, having played only 7 seasons. His dominance, despite the shortened career, was so remarkable that he was inducted into the Pro Football Hall of Fame at age 34, the youngest player ever to receive that honor. Modern surgical techniques, particularly anterior cruciate ligament reconstruction using grafts and advanced arthroscopic methods, might have allowed Sayers to recover more fully and extend his career. Instead, he became an example of how the limitations of medical technology in his era cut short the careers of even the most talented players, the repeat offenders, when it keeps happening. Some players do not suffer a single career-ending injury, but instead experience the same injury multiple times until their body can no longer recover. Repeated injuries to the same structure cause cumulative damage that becomes progressively harder to repair, both physically and mentally. Sam Bradford was the first overall pick in the 2010 NFL Draft, selected by the St. Louis Rams based on his college success as a quarterback. In 2013, during a preseason game, Bradford tore the anterior cruciate ligament in his left knee. ACL tears are serious injuries that require surgical reconstruction and typically a year of rehabilitation. Bradford underwent surgery and missed the entire 2013 season. He returned in 2014 and appeared to have recovered, starting all 16 games. However, in 2014, during the final game of the regular season, he tore the same ACL again. This second tear was devastating, not only because it meant another year of recovery, but because re-tearing a reconstructed ACL is biomechanically and psychologically more difficult to overcome. The graft used to replace the original ligament is not as strong as the native tissue, and the surrounding muscles and structures are weakened from the previous injury and surgery. Bradford underwent a second ACL reconstruction and worked to return again. He eventually played for multiple teams, including the Philadelphia Eagles, Minnesota Vikings, and Arizona Cardinals. In 2016 with the Vikings, he actually actually had a career year statistically, setting what was then an NFL record for completion percentage. However, his knees failed him again in 2017, and he was never able to sustain that level of play. His mobility was limited, and he suffered recurring injuries throughout his career. The repeated trauma to his knee had taken away much of his athletic ability and left him more vulnerable to additional injuries. Bradford's case illustrates how repeated injuries, particularly to the same joint, create a cycle of declining performance and increasing vulnerability. Even when players return to the field, the accumulated damage often prevents them from reaching their previous level of play. The Achilles curse, the unbeatable injury. The Achilles tendon is the largest and strongest tendon in the human body, connecting the calf muscles to the heel bone. It is essential for running, jumping, and any movement that requires pushing off the ground. When this tendon ruptures, the injury is both immediately recognizable and extremely difficult to fully recover from. An Achilles tendon rupture typically occurs during a sudden explosive movement such as sprinting or jumping. The tendon is under tremendous stress during these actions, and if the load exceeds its capacity, it tears. Players often describe the moment of rupture as feeling like they were shot in the back of the leg or kicked. The sound of the rupture can sometimes be heard across the field, a loud pop that signals complete structural failure. Surgical repair involves reattaching the torn ends of the tendon, usually with sutures and anchors. Following surgery, the patient undergoes months of rehabilitation to restore strength and flexibility to the ankle and calf. However, even with successful surgery and rehabilitation, the repaired tendon is never as strong or elastic as the original. Studies have shown that athletes who suffer Achilles tendon ruptures rarely return to their previous level of performance. Running backs and wide receivers, whose positions require sudden acceleration and cutting movements, are particularly affected. The loss of explosiveness, even if subtle, is enough to make them less effective. Additionally, the rehabilitation process is mentally challenging, as players must overcome fear of re-injury while relearning movements that were previously automatic. Multiple NFL players have seen their careers effectively end following Achilles ruptures. While some have returned to play, very few have returned to Pro Bowl or All-Pro level performance. The injury represents one of the most difficult obstacles in professional football, combining severe physical damage with a low likelihood of full recovery. The worst of the worst, what we've learned. The injuries discussed share common patterns that reveal which body parts are most vulnerable to career-ending damage in professional football. The knee is the most frequently injured joint, particularly the anterior cruciate ligament and the cartilage structures. The knee must absorb tremendous forces while allowing for complex movements, and when it fails, the damage is often irreversible. Spinal injuries, though less common, are the most immediately catastrophic. Damage to the spinal cord can result in paralysis or death, and even injuries that allow for recovery often end careers due to the risk of permanent disability from future impacts. Head injuries, particularly repeated concussions, represent a cumulative threat that may not manifest immediately but leads to long-term neurological damage. The NFL has responded to these patterns by changing rules and improving medical protocols. Rules penalizing helmet-to-helmet contact and lowering the head while tackling have been implemented to reduce head and spine injuries. Concussion protocols now require players to be evaluated and cleared by independent medical professionals before returning to play. Equipment has also evolved, with helmets designed to better absorb impact forces and reduce rotational acceleration of the brain. Field surfaces have been improved to reduce the incidence of non-contact injuries, such as ACL tears caused by cleats catching on artificial turf. Despite these improvements, the fundamental nature of football means that catastrophic injuries remain a risk. Players are bigger, faster, and stronger than ever before, which means the forces involved in collisions have increased even as protective measures have improved. The balance between player safety and the physical nature of the sport continues to evolve. The aftermath, life after football. The end of a playing career, particularly when forced by injury, creates challenges that extend far beyond the physical. Many players struggle with the loss of identity that comes with no longer being an athlete. For most of their lives, they define themselves by their sport, and the sudden end forces them to find new purpose and direction. Bo Jackson transitioned into business ventures and became a prominent spokesperson, maintaining a public presence through his athletic legacy. legacy. His story became one of resilience as he adapted to life after the injury and found success outside of professional sports. Marcus Lattimore returned to the University of South Carolina, where he joined the football program as a coach. His decision to give back to the sport that had given him so much, despite his career being cut short, demonstrated his continued passion for football and his desire to help younger players achieve what he could not. Ryan Shazier's recovery from spinal injury became an inspiration to many. His work with the Pittsburgh Steelers in a personnel role allowed him to remain involved in football while also serving as a visible example of perseverance in the face of devastating injury. Robert Griffin III found a second career as a college football analyst, using his knowledge of the game and his experience as a former player to provide commentary and insight. His transition to broadcasting allowed him to stay connected to the sport while building a new professional identity. However, not all transitions are smooth. Some former players face chronic pain from their injuries, requiring ongoing medical treatment and limiting their daily activities. Others deal with depression and mental health challenges related to the loss of their careers and the financial instability that can come with an early retirement. Many players also face long-term health consequences from the accumulated trauma of their playing years. Repeated head injuries can lead to cognitive decline and chronic traumatic encephalopathy. Joint damage can result in early onset arthritis and the need for multiple surgeries later in life. The physical toll of professional football extends decades beyond the final game. The NFL and Players Union have worked to provide support for retired players, including pension programs, healthcare benefits, and mental health resources. However, the support systems are not always adequate, particularly for players whose careers were short or who played before more comprehensive benefit programs were established. The stories of these players serve as reminders that professional football careers are fragile and that the consequences of injury extend far beyond the playing field.